Today I'm talking to Gillian Proctor. She's a clinical psychologist and person-centred therapist. She's also programme leader for the MA in Relational and Integrative Psychotherapy and Counselling at the University of Leeds. Thanks for being here. Right, I'm going to ask you 4 questions in total. So first of all, you're trained as a clinical psychologist, yet you identify as a person-centred therapist. How did that come about?
It's a strange concoction, isn't it? I started training as a clinical psychologist pretty young. I started the training when I was 22. I'd done some work experience after a psychology degree, and I guess before I went on it I hadn't really quite realised the implications of how scientifically based it was. So it had very much an expert flavour of, we're going to train you to be experts, authority, to tell people what to do, to tell other professionals what to do, never mind clients, be real consultants in the mental health field. There was a big push at the time I was training to justify the salaries that we had compared to other mental health professionals, and to justify us having doctorate. So I started the course, learned how to be a scientist practitioner, as you do, which didn't involve any self-awareness, nothing personal, just about these are the scientific principles and this is how you apply them to people. It mainly involved doing a lot of assessment, a lot of questioning of clients, and I was already genius at that. I was known as the Spanish Inquisition at university. I could ask people questions forever. It was a great way to not talk about myself. So I did that, and then strangely I failed placements twice because I wasn't empathic enough. And it really was quite strange because we'd not been taught anything about empathy.
Right.
What's that got to do with it? I'm supposed to be asking questions.
Yeah.
So I really didn't know what they were talking about. At the same time I was really quite unwell. Just 6 months before I started the course I'd had a stroke, and I was physically exhausted and kind of recovering from this. I needed like 11 or 12 hours sleep every night, was kind of managing to go to placement for 4 or 5 hours a day, but I wasn't doing the full-time practice that I should have been doing at all. And probably wasn't up to kind of taking much in really, intellectually. So anyway, I failed these 2 placements on the basis of lack of empathy, and then the course advised me that I should appeal on the grounds of ill health. So they kind of knew the situation was in and were trying to be helpful. So I did, and then I was given sick leave, and I stayed off sick for a year and a half or something, year and a quarter.
Right, okay.
So during that time, I then did an introduction to counselling skills, because this empathy stuff, that's one of the things they suggested. So I went and did an introduction to counselling skills and learnt about the person-centred approach and thought, there's another way of doing this. So, and it suited me much more. It kind of made sense to me on so many levels. So I then got some voluntary work in my time off sick at a place called the Crisis Centre in Leeds, which was a really radical counselling place at the time, really political. It was one of the first places to set up a service for deaf clients. I was part of a lesbian counsellors discussion group. It was like, it was really kind of up there in terms of what was happening politically in counselling, and practised as a person-centred counsellor under supervision, and kind of thought, I'm happy doing this. Can I do it within clinical psychology?
Right.
So I went back to the clinical psychology course however long later, and incredibly fortunately, during the time I'd been off sick, they'd appointed a new tutor who was the only other person-centred psychologist that I'd ever met.
Right.
Sheila Youngson. So it was so fortunate, really. I went back and kind of went to meet her and said, this is the position I'm in, will you help me? And she was brilliant, So
Excellent.
she kind of mentored me through the last year of the course.
Great.
And I went back and did the placements that I'd failed before and used the person-centred approach. Apparently was empathic enough and passed. So, it kind of was a lucky position to be in, really, to have the status of clinical psychology and not have to do the expert nonsense.
Wow. And the rest, as they say, is history.
Well, it is now.